about what is arthritis of the spine. Basically, your back and neck. So, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. So, I help moms of younger kids who work in high stress executive jobs manage the physical aches and pains that come from, that come along with motherhood. And this could be anything from aches and pains, say back pain, heel pain, neck pain, poor posture, a weak pelvic floor, basically all the physical challenges that we face as moms, right from our pregnancy to running after our toddlers or taking our kids to and fro classes, driving them around. Usually these aches and pains are brushed under the carpet because as moms we tend to not prioritize them, or maybe you have and you've tried everything under the sun and nothing's really worked for you. That is where I come in and help you with simple and easy tips to manage these discomforts, these aches and pains that stop you from being from giving your 100% to being a mom, to being a professional, to being productive at work, right? So that's where I help you. All right. So going back to our topic for today, what is spinal arthritis or arthritis of the spine? That is your back and neck arthritis. Now, usually when we think about arthritis, we only think about the wear and tear or degenerative process in the spine. That is, with aging, there is a little bit of wear and tear, or like a little bit of aches and pains that start in your spine. Yes, that is arthritis, but that is just one kind of arthritis in the spine. So if you've been to the doctor and he's given you a diagnosis saying you've got arthritis of the spine, it can be quite overwhelming. So let's break up this term arthritis into the different kinds of arthritis. Um, that you can get in your neck and back. The reason I'm saying neck and back and not mid back is because obviously you can get arthritis anywhere, right from your neck till your tailbone. Well, not exactly tailbone, but till your lower back. But the ones in the neck and lower back are much more common. So let's address the first and the most common type of arthritis, that is your osteoarthritis or OA of the spine. So osteoarthritis, the OA of the spine. This is the one where you find that there is wear and tear or degeneration in the spine. Now, if you are looking for uh, a lot of details on degeneration of the spine, I have done a separate video on this. And if you go to my YouTube channel and you can look it up there, or you can just go on YouTube, type Swati Prakash, that's my name, and then just write degeneration spine, and this video will pop up. And of course, you can have a look. And if you like what you're watching, you can always like and subscribe. So, to put it really in more concise terms for this video, degeneration means like if you have any machine, right? You've used it over a period of years, and there is some wear and tear that comes along in this machine. It's the same with our body. We've used it for years, used and probably abused our bodies for years, right? And this leads to degeneration or wear and tear. Now, this, when it is on a larger scale, when it leads to aches and pains, will be termed as osteoarthritis of the spine. Now, what happens specifically in osteoarthritis is the covering on the bones, that is the cartilage on the bone. You can Google that term if you want. So basically, it's just, if this is, say, the end of my bone, there is like a cartilage or a lining on top of this. So like a protective layer on top of the end of the bone, where, like if this is your joint, so both the bones that form the joints will have a cartilage layer of them on them. So the cartilage wears out, so that leads to pain and inflammation in the joint. So you might have heard of osteoarthritis of the knee. So that is again a similar thing, but we are focusing on the spine here. So this is a more mechanical sort of a problem, and it starts off as a mechanical problem. So you'll realize that when you're bending over, bending backwards, twisting around, say I'm looking behind my chair here. So this twisting action, either for my back or my neck, these are the sort of activities that will get more and more difficult as your osteoarthritis progresses further. All right. So, also, if you've had past injuries, fractures, trauma to your spine, there is more chances of you getting osteoarthritis later on in life. There is no sure shot guarantee that you will, but you're more prone to it. All right, so moving on to the next type, that is not as common as osteoarthritis, but I would say it's one step down from osteoarthritis in terms of how many people get it, is rheumatoid arthritis. Now, you might have heard of rheumatoid arthritis in the small joints in the hands, but it is also quite common in the small joints in your spine, especially your neck. It can happen in the lower back, but neck is more common. Now, in rheumatoid arthritis, what happens is it is an autoimmune condition. So basically, our immune system gets this trigger where it starts to attack the body rather than attacking the pathogens and all the viruses, bacteria, etc., that it is supposed to do. It starts to attack our own body. So it starts to attack the synovium. Now, synovium is also the covering on the joint. So there are different kinds of joints. So depending on the sign, if it's a synovial joint, it will have a synovium covering on it. So that covering on the joint gets attacked by the body, and that leads to inflammation and pain. So now, when you have these smaller joints, neck joints, etc., with arthritis, with rheumatoid arthritis, it can be a very, very painful condition. Now, the another type of arthritis that I would like to highlight here is, I mean, there are lots and lots of them, but another one that is seen in the spine is ankylosing spondylitis. When you say itis at the end of any word in the medical world, itis, it usually denotes inflammation in the area. So with ankylosing spondylitis, there's inflammation in the spine, and it can be a very debilitating condition as it progresses, because your vertebrae, they have this movement, that is how you bend forwards, backwards, sideways, etc. This movement is slowly lost, so your vertebrae tend to fuse together as ankylosing spondylitis progresses. I'm not going to go into the details. It is just to give you a broad outline that there are different kinds of arthritis that we can have in the spine. It's not just the wear and tear. So just looking at my notes here. Yeah, so these are the common ones that I wanted to talk about. And if I've used any terms or if I have not clarified anything, please feel free to ask your questions in the comments below, and I'll be happy to elaborate those for you. If you're looking for some simple solutions, some simple tips and hacks and exercises to manage your neck and back pain, you can join my free community. And I will leave a link in the description of this video. For those of you watching me on Instagram, the link is in my bio. Once you click on that link, it'll open a new page. As you scroll down, you will see my community highlighted in a blue circle. So you can join from there. And this is the community where I do videos thrice a week, and we do challenges or trainings every month. For example, the last one we did was um, about tennis elbow pain. Before that, we did ankle pain, ankle ligament injuries, heel pains, back pain, posture, etc. So there are different kinds of free trainings in there that you have full access to once you join the community. So feel free to join in if it sounds like something that you will benefit from. And I'll see you guys next time. Bye for now.